Hello everyone, my name is Ray Rosario. I'm the Quality Improvement Manager for Accreditation, Regulatory, and Licensing.
Hello, my name is Rosie Garamatan. I am a Quality Improvement Coordinator.
Hello everyone, my name is Maritas Corpus, QI Coordinator.
And we're here today to give you a background about Quality and Safety Department.
What comes in mind when you hear about the word quality? Healthcare quality as defined by Institute of Medicine is the extent to which health services provided to individuals and patient population improve desired health outcomes. The care should be based on the strongest clinical evidence and provided in the technically and culturally competent manner with good communication and shared decision making. As an organization, we embody quality in all we do. In the services we provide, in the knowledge that we share, in the relationship we build with providers, patients, families, and caregivers. Why do we do what we do? It's the right thing to do, and it's our business in our organization. Under one umbrella of quality and safety, we have sub-departments, and we have subject matters experts in patient safety, infection prevention, performance improvement, accreditation, regulatory and licensing, risk management, environmental health and safety. Each department comprises of experts in quality and patient safety, infection prevention, risk management, and performance improvement. Here are a few things that drives quality in patient safety. Regulation, patient safety, required reporting, and quality metrics. In required reporting, there are core measures, meaningful use, and PQRS, and the HCAHPS, which is patient experience. Now I turn over the forum to Ray Rosario.
Thank you, Maritas. I'm here to present to you about accreditation, regulatory, and licensing. So what is regulation and accreditation? So regulation are the rules that must be followed, and accreditations is a seal of approval from any accrediting agencies. So as an organization, we are continually prepared for survey in compliance with the strongest quality of care, such as CMS, CDPH, or the Joint Commission. Accreditation and licensing. Here are just some of the accrediting or regulatory body that visits the organization. Major of them is CMS, or the Centers for Medicare and Medicaid. I'm sure all of you are familiar about Joint Commission. We also have CDPH. So I'm sure you all familiar with Joint Commission. So who are they? So Joint Commission is linked to Medicare and Medicaid reimbursement. They give us what we call the deemed status. Deemed status means that CMS, as a federal agency, assigned an accrediting body. One of them is Joint Commission. So Joint Commission will go and survey a hospital, a clinic, and they'll report back to CMS. Once we follow what we call the conditions of participations, then CMS will grant out what we call the deemed status. And deemed status means we are in compliance with the conditions of participation, or I refer it to COP. I like to present this one. This is one of the slides that I'd like to show to everyone to understand what is the importance of an accreditation, such as Joint Commission. So if we don't have any Joint Commission accreditation, that means we don't have any CMS COP, or the CMS conditions of participation. No CMS COP or CMS COP, no Medicare payments. No Medicare payments means we don't have any revenue. No revenue means we don't have any margin. No margin means we don't have any mission. And of course, if we don't have any mission, we don't exist as an organization. So during the survey, there are looking some of these few items. One is observation. This is the most critical piece and the strongest piece of evidence during a survey, such as they're looking at the physical plant, they're looking at our life safety, environment of care, and also medication administration if you're doing dressing changes as well. They will interview you as the staff, they will interview the providers, they're also going to interview family members and of course the patient. The review of medical records, and of course the non-clinical documentation such as your employee files and review of policies and procedures. So for Joint Commission, for VMC or the Valley Medical Center, we have 3 accreditation. One is home care for specialty pharmacy and durable medical equipment. We're accredited hospital, and we also have an accreditation for laboratory. Regarding our advanced certification, we are stroke certified, and we also have sepsis certified. O'Connor Hospital is also accredited as an hospital and laboratory. And for the advanced certification, O'Connor Hospital is certified primary stroke center, joint replacement for hip, joint replacement knee, and wound care certification. For St. Louis, also is accredited for hospital and laboratory, and is also certified as a primary stroke center. Now I'm going to turn you over to Rosie for patient safety.
Thank you, Ray. Patient safety. This is a sub-department in under quality and safety. What's patient safety? Patient safety was defined by Institute of Medicine as the prevention of harm to patients. Also defined by Agency for Healthcare Research and Quality, freedom from accidental or preventable injuries produced by medical care. What's patient safety practices? Practices are defined as those that reduce the risk of adverse events related to exposure to medical care across range of diagnoses and conditions. Look at this picture. It says it all. Preventable hospital errors cause more than 400,000 deaths per year. It is up to us, up to all of us as an organization to make an impact to reduce this number. So the Joint Commission has developed the Patient National Safety Goals to help prevent the preventable errors that we talked about in the previous slide. Identify patients correctly. We use name and date of birth. Improve staff communication. We communicate accurately and timely. Communication gap cause errors. Use medicine safely. Give correct medication. With correct medication, correct dose, the right patient. Use alarms safely. Alarms are there for a reason, to alert us for if anything were to happen. So we don't silence them, we investigate before silence them. Prevent infection. Best way to prevent infection is hand washing. We all know that. Identify patient safety risk. We need to assess our patients if the patients are at risk for fall or suicide or so on. Prevent mistake in surgery. Provide surgery on the right patient. Escalation/chain of command. Employees are asked to initiate chain of command. Consult if any safety concerns. Consult with your supervisor, manager, or administration who's closest to you. Customer service department. You can call Joint Commission Customer Service Hotline. You can also contact California Department of Public Health, CDPH. Risk management. This is another sub-department under quality and safety. The overview of risk management, or the purpose, is to reduce and prevent adverse medical events, to improve safety of our patients, visitors, and the staff, to reduce potential risk and exposure, ultimately contributing to quality and safety of care. Never events. Has anyone heard never events? Never events are what it says, as it says, events that should never occur. If they should occur, if one occurs, it needs to be reported. So for that reason, California has established a list of reportable adverse events, frequently referred to never events. Hospitals are required to notify CDPH within 5 days if one occurs. Such events must be immediately reported to a supervisor and submitted electronically using the occurrence report or incident report. Here are the logos. The RL is for O'Connor and St. Louis, and the other logo is for Santa Clara Valley Medical Center. Never events started from 27, expanded to 29. They're grouped in 7 categories. Surgical events, surgical site, wrong side of surgeries, patient undergone wrong procedure. Product or device events, patient death or serious disability from use of contaminated drugs, devices. So check your devices if they are maintained, if they have the sticker, the preventative maintenance on them, and make sure your medication not expired or damaged. Patient protection events, patient death or serious disability from patient disappearance while in our healthcare facility. We are responsible for our patients, so let's make sure our patients are in our facility when they are admitted here. Environmental events, patient death and serious disability from burn, electrical shock while in our healthcare facility, or falls that cause fractures. Communal events is another category, that any instance of care ordered provided by someone impersonating a physician, being a nurse and delivering patient care, or abduction of a patient from our facility. Care management events, patient death or serious disability associated with medication error. So we need to give correct medication to a correct patient. So we prevent that event. Radiologic event, death or serious injury of a patient from staff associated with introduction of metallic objects into MRI area. EMTALA. EMTALA stands for the Emergency Medical Treatment and Labor Act. It is a complex law that applies to facilities with dedicated emergency department and labor and delivery department. We, as an organization, do have an emergency department and labor and delivery department, so we have to adhere to EMTALA. Emergency care. EMTALA says emergency care is provided to anyone seeking treatment regardless of the ability to pay or any other non-medical factors. It also says medical screening, exams provided to determine an emergency condition exists and stabilizing treatment or transfer must be performed. Transfer of patient includes confirmation of available space and qualified personnel to take care of the patient. Infection prevention is another sub-department and under quality and safety. Best prevention, that gives it all, hand washing. We now show you a short video from Joint Commission talks about high reliability organization. The key. What do patients want from us? Think about that. Please take care of a thing I came to you for. If I have a skin rash, take care of my rash. If I have pain, take care of my pain. Please do not hurt me. Give me the correct medication. Make sure it's the right person. Please be nice to me. Treat me with respect, dignity. Kindness goes a long way. We have to provide compassionate care because patients trust us with their lives. So, who owns quality and safety? We all do. Here is a quote from Dr. Berwick from December 2004. Behind every gold seal of approval is an organization committed to quality. This is by Joint Commission. Should you have any questions, concerns, here are the contact the leadership team quality and safety. Here are our references.
Thank you and welcome to Santa Clara Valley Health and Hospital System.